Hi everybody, my name is Mary Teeler. I'm a rising senior at Tulane and I'm majoring in public health and cell and molecular biology. I'm a pre-med student looking at med schools now, and so my internship with Goldring Center for Culinary Medicine was a great way to gain a new perspective on health and healthcare while not exactly engaging in the clinical setting. So I came to New Orleans also because I was intrigued with the deeply rooted socioeconomic or racial disparities that were attributed to health. There's a lot of issues throughout history with whether or not people had equal access to healthcare, whether or not the quality of care was the same throughout the city or for certain populations, and then adding an extra layer of natural disaster and things of that nature. New Orleans became a really complex city in terms of providing equal care access for everybody in the city. So me wanting to come into the city and kind of look at that through the lens of public health was really an interest of mine and something I valued when choosing a school. And so Goldring was perfect for this. They look at the population in the 7th Ward. This population has been studied and has a life expectancy of 20 years on average lower than the national life expectancy, and 22 years below the life expectancy average of just New Orleans in general. So many private organizations saw this as an opportunity to go in and figure out what was going wrong in these communities, or what were they not having access to that made them particularly susceptible to some sort of life-limiting health problem. What they saw is that a lot of these people have dealt with living in a food desert, so this means that they do not have access to a grocery store within 1 mile of their residence. And for this reason, along with a lot of other reasons, cultural things, just availability of other restaurants in the area, work, transportation, all of these things have really caused issues for these people in terms of getting nutritious food in their lifestyle and their diet. This is really one aspect of many things. A lot of times neighborhood safety contributes to lack of ability to exercise for these populations, not being taught in school health and how to care for yourself and have a healthy meal. All of these things kind of come into this conglomerate of a larger issue, which results in things like diabetes, hypertension, nutrition-related diseases like high blood sugar, some sort of malnourishment, obesity, all of these things, and that can lead to cardiovascular disease, decreased quality of life, depression, really a series of things. And so what these private organizations decided is that nutrition is really a big deal. So there's a lot of places in this area where Goldring is actually on Broad Street. It's in the Whole Foods in that area, and that group of organizations that are all stationed there call themselves the Health Hub. And so what these organizations together advocate for is nutrition literacy in terms of healthy shopping, meal planning, affordable, sustainable meals that meet the recommended daily average as set by the Food and Drug Administration, and then also just sustainability. A lot of times if it's not convenient to cook, convenient to clean, affordable, all of those things, it's really not a sustainable intervention in terms of really changing the lives and adding that tier of convenience and really incentive for them to actually value nutrition in their lives. And so these organizations work to do that. They have gardening, and it's a community garden, but also gardening classes. They have the Liberty Kitchen, which hires people and then serves healthy dishes. They have worked with Whole Foods to make sure that the products that they're selling are affordable. And then Goldring themselves brings in patients typically who have been diagnosed through the Tulane Medical School with some sort of nutrition-related disease to a 6-week, typically, series of community classes. These can be kid classes, family classes, you name it, where they'll learn a series of recipes, breakfast, lunch, dinner, dessert, you name it, which are all available on the Gold Ring website, and follow the Mediterranean diet. They'll learn these recipes, learn how to cook them, get a free meal, understand some cooking tips and reasons why these meals are particularly of better nutrition than other meals, and how to make those little substitutions into their home-cooked recipes. And then they'll go home and be able to try these recipes at home. All of our recipes at Gold Ring are under $1.50 per serving. And typically wholesale products are under $5. So if your recipe calls for flour, going to the grocery store and purchasing an entire box of flour should be under $5. We try to keep our list of ingredients below 10, and then typically the preparation time is below 20 minutes. We typically do our recipes within an hour, so that includes all the cooking time, any baking time, etc., etc., so that these families can understand and really enjoy cooking and understand how important it is, really not even just in terms of nutrition, but also having that family time, sharing that time with your spouse, your loved ones, friends and family, everything. And so we really advocate for that. These recipes are available online and actually have been part of a larger push towards getting all groups like nationwide that have a similar issue in terms of nutrition-related disease to really start incorporating these recipes into their lifestyle. As you know, that obesity is a national problem, and so working on this and starting with these recipes, making it convenient, interesting, flavorful, is really a great way to empower people to keep it autonomous. They can preserve whatever cultural or family dish that they want to keep in their life and just really kind of apply these substitutions. It gives them that autonomy, it gives them that knowledge. Again, it's advocating for food literacy in a fun, interesting way. And so what I personally loved about my internship was that it was a really forward way of public health thinking. Oftentimes we talk in public health about how we want to implement a preventative measure for a widespread population. And so starting here at the recipe gives them, completely independent of their health, a way to start making better choices in their life. Every meal you have is typically up to your choice. Whether you're going to a restaurant or eating at home, we want to give them that knowledge and that power to make the best decision they can for themselves, and help them understand how important that one dish or just a few dishes a week might be to improving their lifestyle, their happiness, their weight, all of these things, their energy levels. We want to tell them exactly what they can do to enhance their life in a plethora of ways, and really be on the preventative side of later down the road incurring a nutrition-related disease. So this way of thinking I thought was really special and unique, and the way in which they tied it into medicine and brought in physicians to our conference, and a series of other doctors to come in and speak on how this can actually be a prescription or a means of therapy for people who are there, patients who are coming into their offices seeking guidance, was really interesting. We can kind of wean them off of those medicines for blood pressure, blood sugar, all of those things, when we have these other interventions that are flavorful and enjoyable and more sustainable than actually having to go into that pharmacy every month and getting those prescriptions filled over and over again. They're more engaged in what's actually going wrong in their body, and able to actually feel as though they're a part of fixing it. We also, I personally thought that we did a really good job of addressing racial and socioeconomic disparity. The way in which we really focused in on a group of people who were suffering more than other areas in New Orleans, and then actually going in and finding exactly what was wrong, to me was a really important way to actually incorporate that aspect of public health, where we're looking at disparities, we're figuring out what's wrong, we're going in and asking these communities questions, and then we're going from there. Again, they also were able to reconcile a lot of issues with whether or not interventions of this nature are robbing people of their autonomy, of their culture, of these things. And so, like I said, we're teaching these people to go home and then do these things for themselves. We're not just giving them these dishes, we're showing them how to do it, so they feel empowered to make these decisions further in their lives, to retain this information, to go online and find whatever they need, and then really go from there. And so preserving that autonomy and ensuring that we're teaching them to actually do something versus just doing it for them, to me was a critical component of having a sustainable public health intervention, and really something, as being an intern there, I was able to take away as something that I would want to incorporate in my career as a doctor. It's applicable at the global level. Like I said, it's a Mediterranean diet, but